Welcome back. This is the Ben Shapiro Show. We're joined on the line by Joel Griffith. He's currently a research fellow for the Institute for Economic Freedom and Opportunity at the Heritage Foundation. He's also been deputy research director at the National Association of Counties, among other organizations. Joel, thanks so much for joining the show. Really appreciate it.
Thank you for having me, Ben. And I wanted to say we missed you at the Young Jewish Conservative Shabbat this past week.
Oh, well, I appreciate it. So, apparently, are you talking about the Young Jewish Conservative Shabbat over at CPAC? Because apparently that was a wild place.
It was a wonderful, wonderful time, all the other events notwithstanding, and I know you've been a big part in past years, but I know you also are a father once again, and congratulations on the newest addition to your family.
I really appreciate it. So let's talk a little bit about coronavirus. So obviously that is a hot topic given what happened at CPAC and across the country. Well, let's talk about how seriously should we take the risks of coronavirus. So it is very difficult to get any sort of solid information. We've seen widely variant death rates, widely variant infectious rates. The fact is that the informational deficit is causing a huge market drop. It's causing people to stock up for the next couple of months. It's causing a fair bit of public panic. How panicked should Americans be about coronavirus?
Well, I think one thing is very clear from all the data that we have, and that the way we react to it and the way that we treat it really is determinative of the outcomes and what the mortality rate is. If you look at China, for instance, compared to Singapore, China is really the model to not follow with the lack of transparency, lack of information. Needless deaths came of that, and there's going to be needless economic consequences there and elsewhere. If you look at how Singapore has handled the situation, which is far different, far more transparent, far more targeted, their mortality rate as of a few days ago was actually 0, and the number of people recovering was rapidly increasing. So there's a wide range of information, a wide range to combat this. And what I've been saying is take precautions when needed. If you're sick, see a doctor. Don't go walking around if you're sick, but don't panic. And we've seen a lot of that, and we've seen a lot of sensationalizing of this in the media and elsewhere over the past few weeks.
And Joel, specifically, it seems like the areas in which most people's lives will be affected directly is when it comes to public gatherings, business places, sporting events, that sort of thing. We've now seen that Italy has basically banned all sporting events. We've seen that the country of Israel is putting everybody who is traveling back into the country in a state of quarantine. And as I say, there have been widely variant death rates even in Western countries. Italy obviously has had a significantly higher death rate than, for example, South Korea. South Korea is reporting its death rate in at about 0.66. The death rate in Italy, if all you were using were the number of confirmed cases versus the number of deaths, that's like almost 5%. So with all of that said, what should U.S. policy look like? Should the state, federal, and local governments be coordinating to basically bar public events larger than a particular size?
Well, I think that's definitely an unusual road to go down in the United States, of all places, to be doing command and control like that. I think that the coordination is wonderful that we're seeing between the CDC, the Centers for Disease Control, and also state and local governments. That's highly important, making sure that people can be tested if they're showing these symptoms, and making sure that we have that space available to actually treat people should they actually come down with this illness. That is highly important, probably more important than doing mass quarantines. If you look at where the outbreak occurred in China, for instance, in that province with tens of millions of people, and there were only a small number, a very relatively small number of critical care beds available, so you ended up with people that couldn't get that care and ended up outside of those hospitals, and that's a dangerous situation.
So does the United States actually have the resources necessary in order to deal with the possibility of a real coronavirus outbreak? There's been a lot of talk about the number of beds that are available. Obviously, there's even conflicting information out there about what level of sickness you have in order to go see a doctor, because one of the things we're afraid of is people who are very mildly ill being checked into the hospital and taking up beds. So how well prepared is the United States for this? How quickly can we get online for it?
Yeah, well, I think that's where it really becomes contingent on people having the proper information. If you know what symptoms to actually be aware of, you can very quickly see your urgent care physician to then make that next step of determining whether or not you need to seek further care immediately rather than just self-quarantining to be cautious. That's where that becomes all important. As you mentioned, if you have too many people that actually don't have the sickness or don't need that medical care even though they do have it, then that's if you run into a situation where you can swamp the existing facilities no matter how good of a care system you have. And that's where this information and transparency becomes that much more important.
So let's say you're advising the Trump administration today and they ask you, help us come up with the federal policy with regard to coronavirus and particularly on economic growth. What do you advise the Trump administration, considering that there's been a lot of recommendations, economic stimulus, guaranteeing small business income, unemployment. Well, what exactly would you be advising the Trump administration on both the spread of coronavirus and also on the economic impact of coronavirus, which, again, seems to be driven largely by lack of information?
Yeah, on the economic side, and this is highly important, there's a lot of calls for targeted relief and for even bailouts or targeted tax cuts. And this could be a situation where this begins to impact the economy as a whole. And with the market down now 20% for the last few weeks, it's approaching that situation. But if we're going to get into any of these types of measures that are targeting individual sectors or companies, anything like that, you got to be very cautious of. It should be very temporary and very limited if we go down that route. I mean, the fact is, when it comes to producing long-term growth, we've had experience with big federal stimulus programs during the 2008 crisis. And what did we get from that? We got trillions of dollars worth of debt in that crisis, and not much of anything to show for it. In fact, I'd argue we had worse economics, slower economic growth. The things that work in normal economic times, that's what we need to be focused on for longer-term growth. On the supply side, I mean, now would probably be a great time to start looking at rolling back some tariffs, because this could be a supply-side problem where we can't get the goods we need, we can't get intermediate goods that we need to produce those final products. So why not go ahead and do what we know is positive, is a positive program in good times, would actually be a good thing in a bad economic stretch as well. Let's look at that. Let's look at permanent tax cuts, tax reductions on investment, tax reductions on income. That works whether we have a crisis like this. It also works when we're in a time of relative calm.
Well, Joel Griffith from the Institute for Economic Freedom and Opportunity at the Heritage Foundation, really appreciate your insight on this topic, and obviously best wishes to you and your family. And we're all going to pray for everybody who is suffering with this thing, and hopefully it blows over fairly quickly. Joel, really appreciate the time.
Thank you, Ben.
All righty, folks.